Hello, I am Kindra Mulch, and I am an RN. I'm the director of and manager for the home health and hospice here at Kit Carson County Memorial Hospital in Burlington, Colorado, serving Kit Carson County, parts of Cheyenne County, parts of Yuma County, and even parts of Lincoln County.
Great. Well, thank you so much, Kendra, for being here. The first thing I'm going to ask you is, it looks like you're sitting in a storage closet doing your video.
I am. About 3 weeks ago, our hospital implemented our surge plan, and our surge plan required my office space was the space that has always been in the plan for a surge capacity. So my staff and I had to pack up all our belongings, get ourselves mobilized, and then we were deployed to a different location. Fortunately, our deployment only took us out of our building and across the alley and into a small classroom here at the hospital. But it certainly did require us to rethink and redo our business practices, where we once had more space, and now we're all in one room. And the storage room, which I'm in right now, is where we've moved all of our supplies. And then this is also our private room. It's a small room, so there's not much room for more than a couple people in here. But yeah, that's why you see me in a storage closet.
So how many years have you been a nurse? Could you share that?
I've been a nurse for nearly 40 years.
So during your 40-year tenure, have you ever seen anything like this?
So, I was a public health nurse and I am a public health nurse. I still am a public health nurse for most of my career. And so I was able to experience when we went through the AIDS epidemic, when we went through H1N1, when we did SARS. So I have been a part of the public health system in Eastern Colorado and our state for epidemics that have certainly impacted our populations. I've worked with people who had to be in home isolations for certain communicable diseases such as tuberculosis, but never have I had opportunity to participate or be a part of, and I don't even know how to describe what we do now with COVID.
So if you had to say, what were the biggest changes, other than moving for you, what were the biggest changes that you've seen in patient care and communication?
So it's been a roller coaster of emotions, and almost an inability to really grasp any kind of long range plan. I don't even think we can hardly grasp intermediate plans. We geared up for a surge, and then because of our social distancing and our best practices, we haven't experienced a surge at this time in Kit Carson County or in my catchment area. So we're actually, as a manager, I'm actually in the midst of discussions. Our hospital district is actually doing some furloughs. So because of what's happened with COVID, our hospital, like our same-day surgeries, our outpatient clinics, even our emergency room has seen significant decreases in patients. And well, in fact, same-day surgery and specialty clinics we've closed down. So that required a bunch of layoffs for people. In the home health and hospice industry here, we had a lull in our business. And I'm not certain the genesis of that lull. I certainly don't want to attribute it to COVID, but at this time, but there was a lull in our business. So we decreased staff, thinking, well, we wouldn't need as many people. And then now, today, we're increasing in numbers. And it's hard to really know whether or not that's related to COVID, or specifically related to COVID, or how far down the line it's related to COVID. People don't want to go to the hospital if they don't have to. They've never really wanted to go to the hospital, but they went, I think, at times maybe when today they're deciding, well, they'll just stay home and they'll convalesce at home. And so it's hard to know how to staff. And people are worried about getting infected. People are worried about their loved ones. That was people, by that I mean my staff. Yet we have this call to help. And so the emotions run the gamut of, for me personally, I retired and found that retirement just didn't suit me real well, and that I really needed to get back into some direct patient care, and I needed to be around in the healthcare business again. And then this whole COVID thing comes up, and I start to wonder myself, I'm kind of tired, I'm kind of exhausted. And then my family is saying, why are you doing this? You don't have to do this. And it's really a strange time, because I don't have to do this. I don't have to work this hard financially, but I have this other piece of me saying, well, we need nurses, and we need nurses who will go into homes and who will risk becoming infected, because that's what I do. So long roundabout answer.
No, it's certainly a challenging time. How do you, I'm going to talk a little bit about how you're doing personally, and how do you lead your team, and how does that work?
So my team is, wow, how do I lead my team? I'm using more humor. I'm not necessarily a funny person, but I do try to bring some joy and fun into work. And I've never in my entire career really walked in each morning consciously thinking about, I've got to be pleasant today. I have to exert a great deal of patience. I want to be kind. All those kinds of human behaviors that are a part of me. I never really stopped to make myself be consciously aware of doing that. Now, when I come to work, I am trying to be especially conscious of being kind and recognizing that my staff, the dilemmas they face every day, the situations that they have to discern whether or not they're going to be able to manage. Seeing a patient in home health when you are putting on all your PPE and you're trying to figure out, okay, what level of PPE? I mean, some of our patients are wanting us to be in PPE, even though they're not COVID patients and they have no symptoms of COVID. They want us to be extra precautious. And so that's, staff are like, you want me to go do a shower, and you want me to do it with a mask and with a face shield and in a paper gown? And I have to say, well, you just have to go do your best.
What has surprised you the most?
Wow, what has surprised me the most? People's need to make this simplify COVID. So people want to make this be something that is almost magical. Like if we wish it away, it'll go away. And if we open back up, and if we stop this silliness, we can handle this. And I'm intrigued by that. But while at the same time, though, I want to be clear, the people who are saying that are staying home and staying socially isolated. Many of the people that my friends and family are observing the social isolation and the precautions, but they're talking about the fact that we cannot let COVID run our lives anymore. They're real tired of COVID running their lives. And I'm trying to discern that myself. I'm pretty tired of COVID running my life. But I know as a nurse and a public health practitioner that that's when the virus will get us. When we drop our guard, it'll sneak right in and get us all.
Let's talk, if you will, share with me, you live in a frontier county. There aren't that many frontier counties in the United States. So there's a lot of social separation that happens in your county because there are so few people. How do you think that's impacting frontier people versus people in an urban or more ruralized area?
Oh, so we're grateful for our frontier county and the opportunities to have social distancing just as a matter of course for us, but we are a people who congregate. So not being able to sit in church on Sunday with my church family and my faith family has been really bothersome for me and a number of people. And for me, that's kind of that's how I start every week, and that's my ritual. So that routine has been changed. I do church via Zoom or Facebook, but it's not the same as sitting beside the people that I want to be sitting beside. As far as in our frontier community, many things are going on as planned. Like right now, it's spring, and we are preparing to plant corn. We're out spraying winter wheat, and we're getting our sprinklers running. So many aspects of agriculture are continuing, but yet our restaurants are still closed. Our main street is essentially shut down. So it's this conundrum of there's a side of us that's busy and active, and then there's a component of us that are staying home and staying away. And for frontier people, not being able to get out and see each other, when we go to the drugstore to pick up our medications, that's also a time when you connect with the people that you know that work at the drugstore. Now, when you go into the drugstore, you can't get close to anyone. And we wait outside to make sure there's not very many people in the store. And we wave at each other instead of getting out and talking to each other and hugging each other and touching each other. So for frontier people, I got to be clear that we like social distancing. Many of us like to be apart, but then we have a need to be together. And so we have the occasions like church or, oh my gosh, high school sports. It's been really traumatic for me and a number of my friends that there's no softball or baseball games to go to this spring. And even our 4-H riding club, we haven't been able to start our kids practicing for the state or for the county fair with their horses. We don't even go to the arena because of the need to stay apart.
Think this is going to change both rural communities and future healthcare providers?
So in our rural communities, we pride ourselves in our intestinal fortitude. So I want to be really clear about the fact that we are determined we're going to survive this, and we're going to come out on the other side of this stronger. How that affects our healthcare is it's going to be really interesting, actually. Some of us believe that we will see some great revelations in healthcare, particularly from the payer side of healthcare, so that there won't need to be near as much paperwork. The business in healthcare, and boy, can I talk to you about paperwork in home health and hospice. The business of oversight is just beyond belief, and the amount of energy that it takes from healthcare providers to do the paperwork side and not do the patient side, it's really out of kilter. what I'm hopeful for in our frontier communities is that we're going to be able to demonstrate that all these waivers from CMS do not matter as far as patient care. Patient outcomes going to be just as good. We're going to take care of patients. We're going to prove that you don't have to have all those quality measures. You don't have to force me into doing quality measures. I do provide quality care without being told how to do it. And what I really see in our frontier community is the opportunity to be able to prove that we're trustworthy, and that surveyors don't need to come out here and don't need to provide that level of oversight. The people themselves are judging whether they're getting quality care. They're not getting quality care, they're going to go somewhere else. And so you ask what happens in frontier communities. So I do think that there might be some places where care is inferior, and people will choose to go to the city or somewhere else for their health care if they believe that what they get at home is inferior to what they can get in the outside community. Vice versa, we have some people from the city who are actually wanting to come to our smaller communities because of our healthcare system, and think, well, gosh, if we lived out there, they've got great doctors, great nurses, a great hospital system. Let's go out there and we're going to telecommute, or we're going to work in different ways. So already, like in our little county here, we know of families whose kids decided to come back to this community during this time when they're not working in the city. They came home, and they're figuring out how to work remotely. So the impact to our healthcare system and how our healthcare providers meet the demands. And I want to be also really thoughtful about frontier healthcare providers. They've had to think on their feet their whole lives. That's what their career is all about. They are masters at change and masters at preparedness. And our healthcare system, I'm really quite proud of, actually. And I think we're going to do just fine.
So I'm interested to know, how do you provide different care if you do, because you know your patients, you see them in the small town? Is that a different type of nursing that you're experiencing now because of that familiarity?
So yes and no. I know most of my patients. We have some patients that we don't know. And during this time of isolation, particularly where our home health patients, the nurses are going in, but their family members don't go in. So we are providing a level of connection and touch to particularly our elderly population. As you probably know, the long-term care settings, the assisted living facilities, the congregate living situations that we have in our community have all had to shut down to visitors, except for essential visits. So home health nurses are essential. So we are still going in to see our patients. So we're still touching them. And what I'm finding, and by the way, you asked me a question earlier about my staff. I used to be pretty thoughtful about how much time they were spending in a visit and get that visit done because we got to get on to the next one. Well, now I will tell you an adjustment I've made is the connection that we're making with people. And we've always known this as nurses. The time we spend with them is as critical to their health outcome as the procedures that we are there for. So for my staff and for me, spending more time with our patients, just chit-chatting, just making a social connection, talking to them. By the way, most of them love to reminisce. And so, boy, that's some interesting stories that I've heard, is talking with people who remember about when measles outbreaks happened, when the chicken pox came through when they were kids, and the difference between the measles and the German measles. So I've heard some interesting stories from patients that remember those kinds of outbreaks in their history. So back to what it's doing for us nurses, and for my profession, it's we're providing a stopgap for people in the family, and serving as surrogates in some situations. The way that you and I are meeting now through Zoom, this is a fabulous way to meet. I don't want to minimize my how the value I place on technology, but even you, my old friend, I'd much rather be in a room with you. I have a need, a human need, to see people in person and get your whole body language. And you see how I use my hands when I talk. So people's body language is really important to me. And although Zoom is a real nice option, and I'm real thankful for it, it doesn't take the place of human connection. And in the business of healthcare, we know that telehealth is, by the way, we're using more telehealth and telemedicine. And it certainly is appropriate in a number of settings, but I don't think we'll ever replace the need for good healthcare to happen in person, and good human connections will never be replaced by a video conferencing capacity. They're just stopgap measures.
So you're doing all this amazing stuff. Your staff is out not only providing clinical care, they're providing behavioral health. I would imagine that many of your staff members are taking cookies to their clients or whatever, because that's what we do in rural communities.
That's true.
How long are you going to keep this up? How long can you, and who's supporting you? And
so we'll keep this up as long as we need to, and I know you hear that over and over. In the home care industry, our patients are homebound if their Medicare is their provider. So we have some expertise in dealing with homebound patients that other areas and other healthcare professionals might not have as much opportunity to understand and or know about working with homebound individuals. Not all of our patients are homebound, though, so we get to see both sides of the spectrum. And the part that for my staff and for me is now we never worried about our patients fearing us, and we never really feared that we were going to be transmitting a communicable disease to our most vulnerable population. And so it gets right at your gut when you have to stop and think, okay, do I have a sore throat? No, I don't think so. If I drink a coffee, will that go away? Do I have a tickle there that could be infectious? I mean, I have to really be thoughtful. If I'm coughing, is that because I just swallowed wrong, or are my allergies acting up, or am I starting to get sick? And yes, we take our temperatures twice a day. I wear all the precautions, so does my staff, but we have to be really thoughtful about, we can't take any germs into people's homes. We also don't want to bring any germs out, acquire any of them in their homes. So that truly is providing a challenge for us in our work with our homebound population and with our people who are socially isolated. Their personal cares, I'll tell you, like, some of the people are like, I'm not going to go anywhere and nobody's going to come to see me anyway. So we have patients that are refusing just some basic personal hygiene just because, and I'm convinced they're depressed, and they have a right to be depressed, for God's sake. And so how far I push staff to push patients to actually engage in self-care is something of course, we've had some discussions about that through the time, but we haven't had the discussions we have now about how hard do we push patients to engage in personal care, and or to open the blinds in the house, or think about what they can control versus what they can't control.
You've spoken a little bit about this, but are you concerned about long-term behavioral health impacts from the isolation from your clients? And if so, who in the rural community is there to provide it support now or in the future?
So I am really lucky to have a team of people who um, have worked in this field for quite some time and who are really keen on recognizing behavioral health manifestations that aren't within the category of norms or are bordering on the categories that recognize that there's potential problem. I have on staff behavioral health specialist. So I'm really lucky. Our district got very proactive before COVID and sought out an LCSW to work in our hospital. And because I'm a part of our hospital, she also gets to work for me and with me, not for me so much as with me and with my team. So we can refer to our clinician and seek a lot of professional guidance. She in turn works with the primary care providers in helping to discern, are these people who are candidates for some medications, or are there other types of therapies that would work better for them? So that's how we're dealing with it. Oh, I cannot be remiss though in telling you that our faith-based community in this, and probably all over the world, but for sure in this frontier community, our pastors have stepped up to the plate. They are taking things to people's homes. They're running errands. They're providing. They're just doing some phenomenal work out there. That if it wasn't for them, we would not be surviving.
How do you want history to remember this event?
I have thought about that. I have adult grandchildren and I have little grandchildren. My oldest grandchild is expecting his first baby in the next 4 weeks. That's presented a great deal of concern for me and a lot of consternation. The next oldest one was a student at a university in the city, and got a notice on her dorm door that the dorms were closing down, and she had a very few hours to clear her dorm out and come home and pursue her studies virtually. And that's not working out as well as what we had hoped. And then I have these little baby grandchildren. I have a 6-year-old granddaughter who's in kindergarten, and she knows how to use Zoom, by the way. She's trying to continue her education, her formal education with her kindergarten teacher through Zoom. She has a younger brother and sister. So I do think about how I want them to remember. I'm used to being real connected with my grandchildren. I see them every day. But I also care for my elderly father. And oh, by golly, he'd be pretty peeved at me if he heard me call him elderly. But my dad, I'm his primary caregiver, and I've been really concerned about my own health because I have to see my dad every day, and it's not a choice really for us. And so I think about how I want my grandkids to remember how we cared for one another, how we dealt with the social isolation and distancing. And my little 4-year-old granddaughter was just bawling her eyes out with her arms outreached, screaming almost, "Grandma, hold me, hold me, hold me. I need my back tickled." That's what she told me. She's screaming a fit because she needs her back tickled. And I couldn't, I was torn. because I've been staying distant from my babies and just seeing them at a distance and not holding them. And so I'm going to tell you, I took the risk and held her hard, and I tickled her back. And we were standing outside, and I made all these um, uh, reasons for why what I did was logical. But I did have to think then, because I was leaving their house and going to my dad's house. And it did make me stop to think about, oh man, and my babies don't go anywhere. So I'm thinking, well, they couldn't be, just crazy thoughts. So how I want to be remembered as thoughtful. I want them to know that we weren't, but we weren't overreactive, that I needed to tickle her back. She needed that. And then I needed to go on and see my dad. And I exercised good hand washing precautions. I made sure that I stayed a distance from my dad. I have observed myself. That happened to have been 14 days ago. So today the cycle starts all over again. So I want people to remember us as resilient. I want them to remember us as thoughtful. And not crazy. Like, I want my kids to know that this was a time that we exercised our best judgments. We did what was best for humankind. And I think they will. I hope they will.